My name's Andrew Hayes. I'm a professor of sarcoma and melanoma surgery, and I work as a consultant surgeon at the Royal Marsden in Chelsea and in Cavendish Square. I became involved in super surgeons because someone asked me whether we were doing interesting surgery. Also, soft tissue sarcoma is something which many people haven't really heard about. It's quite uncommon, and I felt it was a good opportunity both to, display some surgery which was a little bit different, but also give some exposure to a really rare cancer which needs a little bit more exposure so that people are aware of it. So I think the reason why it's important to showcase some of the work we do at the Marsden, it's a number of reasons. I think a lot of people don't understand what cancer patients go through, and sometimes some of the things we see in this series are upsetting, and I think it's important for people to realize that it's a very tough journey that many patients with cancer go through. But also I think it's important to show patients resilience and optimism. So I think it's good to be expose the whole story for what a patient experiences as they go through their cancer journey, and I think this series does it very, very well actually. I work in two areas of surgical oncology, which is the surgical treatment of cancer. I work in something called soft tissue sarcoma, which is cancers that arise in the muscles and the fats and the soft tissues of the body. And I also work on the skin cancer unit, principally working in the field of malignant melanoma, which is the rarest, but also sadly the most dangerous of the skin cancers. So the thing which makes Royal Marsden really special as a place to work is really the number of experts in the field of cancer that are around you all the time, whether they be scientists in the ICR, specialists in medical oncology, clinical oncology, and also other surgeons, all of whom are focusing usually on very rare and specialist areas of cancer. Working at the Marsden is an amazing place to work because there's this interplay between the cancer charity and the institution. So our amazing new building in Sutton, the Oak Centre, has been hugely funded by the cancer charity, and the experience of patients going through that, both in terms of earlier diagnosis, better experience being treated. From a surgical perspective, the cancer charity does lots of practical things, like they buy lots of our important equipment which we use in the treatment of patients with cancer. So at the Marsden, pushing the boundaries, particularly in terms of research, is crucial to improving the outcomes of patients. And it wouldn't happen without the cancer charity being able to support that research. We've made great headway in many cancers over the last 20 years, but there's an awful lot of work still to do, particularly in rare cancers, particularly my specialist area, soft tissue sarcoma. We've still got a long way to go. The problem is not completely solved, but I think at the Marsden, we're at the forefront of trying to solve that problem.